Hi everyone, this is Mr. Neil Wright, consultant audiologist and director of ClearWax. I have a patient here who attended with bilateral occluding, dry wax and dead skin keratin, and I took the initial video using the WAXscope endoscope and decided to revert to the WAXscope for the procedure itself. The WAXscope is our latest innovation and it's due to be launched very imminently. I'm hoping to receive some good news at the end of this week, which will allow me to advertise the launch date and some more training dates. If you are interested in the WAXscope, please do email info@clearwax.co.uk and we can add you to our mailing list. And I'm using our 4.25mm speculi here. This is our medium size speculi. We have got two larger sizes, a 5mm and a 5.75. And we've also importantly got a smaller one, a 3.5mm for those very narrow ears, stenotic ears or pediatric ears. And this, as I mentioned at the beginning of the video, it's very dry wax and skin, so I'm just gently peeling it away. And we're just to the back part of the ear canal. Unfortunately, that came out in a very large piece. So the ear canal is more or less clear now. Just a bit of debris there, just right at the entrance. You can see the great magnification, clarity the WAXscope provides, and in a moment we're going to adjust the focus. It's so easy to adjust the focus. It's just a swipe on the screen. You can just see how prominent those blood vessels are that are supplying nutrient rich blood full of oxygen to the handle of malleus. So this is their right ear, and the right ear was a bit narrower, and you will see halfway through I'm going to revert to our 3.5mm speculi. And they do have a bit of otitis externa in this ear, so a slight bit of inflammation and a bit of itchiness, dry skin flakes. I myself have never really used the speculum above 5. I don't really feel the need to. I think to get good visualization of the eardrum, you must get a good insertion of the speculi. I can understand using a big speculi just to widen the entrance of the ear canal, but you're going to find it difficult to insert it past the second bend, I feel. But it's there. I just haven't felt the really need to use it myself. With our speculi, because we've got an open slit at the roof, it just gives you that extra maneuverability. It also doesn't prevent the obstruction of the optical axis. So if you've got the instrument going right through the middle of the speculi, of course the camera is also projecting, that's the optical axis of the camera and the WAXscope lens, and it's going to be obscured and obstructed by the instrument. So having that slit at the top, not only does it improve visibility, but it also improves maneuverability. You may have noticed there, I've just reverted to the smaller speculi. It's a 3.5mm, so it's more narrow. It allows me to enter the ear a bit further past the second bend, so I can dilate, straighten it, and get a bit of visualization when removing really deep wax. I'm trying to avoid using any drops, because any olive oil spray or drops, because the patient does wear hearing aids and they're going to be leaving the clinic wearing the hearing aids. So I just don't want any oil, if possible, that may block the sound bore of the hearing aid and reduce amplification. With keratin, as you probably are aware, if you've been watching my videos and channel, you do, or if you perform your wax removal yourself, you get a lot of reflection. That's because of the keratin within the dead skin. Keratin helps to reflect light. It's a very good reflector of harmful UV rays from the sun as well. That's one of the properties of keratin. It's also hydrophobic, helps to repel water. You may tell by just the colour of the ear canal, it's a lot more red than the left side, so that's just a bit narrower, a bit more inflamed, swelling. So just a bit deeper here. Roscoe with the WAXscope as well. When you adjust the focus, and I said it's really easy to do, the focus it's been done in such a way where the higher the focus, when you swipe it, you know you're going deeper in the ear, and also vice versa. The lower the focus, you know you're getting objects near the entrance more in focus. So you kind of helps you know how deep you are in the ear canal. So just say you set your focus onto the midline, you know more or less that wax is the middle of the canal. So it's quite useful in that respect as well. So again, just trying to wriggle this through. So the obstruction's more or less clear. Well, it's completely clear actually. So I'm just going to try and get some dead keratin out around the edge. Just at the floor of the ear canal here, just between the first and second bend. You can see some dead skin that's coming away too. Got to avoid clarinetting. So in a moment, I'm going to revert, I believe, to the fine end suction probe. So with the fine end, you're less likely to get any clarinetting. Clarinetting is when the skin violently flaps at the tip of the sucker, and it releases and it emits a very loud, high-frequency squeal, which can be deafening for the patient and also the specialist. As you can see, the fine end it's a lot better with clarinetting. So it's just a bit more skin left. So I'm just getting it in focus there. So the eardrum is in the distance, but we haven't got the eardrum in focus. So it's blurry, but in a moment, again, we're going to just adjust the focus. There we are. So once more, you can just see how clear and vivid those blood vessels are. And the speculum is not really inserted any further. That's all the dead skin keratin I removed from both ears. You can see the different shades. The darker shades are the oxidized, the older dead skin and wax. So again, if you are interested in the WAXscope, please do email info@clearwax.co.uk and we shall add you to our mailing list. Thank you, bye.